All right, so we've been having a blast. We've been doing on Annie's skin. We did the Hydrafacial with the Elastin Booster Face Neck Decolletage. So I used the body tip, and this is really great because it uses the vortex fusion of the Hydrafacial, which is their patented technology, which super spins up the dead skin and infuses simultaneously with the targeted serums, and has a huge tip for the body that feels really, really good. So she asked me a good question about the decolletage, and I guess selfishly I love that question because I'm always working on mine. I feel like the pigment on mine is uneven, and I feel like I want to work on the little lines that kind of look like a bit of a butt crack. What's your concern on your décolleté, Annie?
Definitely some of the sun discoloration, and especially from coming off of the summer, even though I wear sunscreen, it still seems to be an area that I have some discoloration from the sun. And then also the fine lines and wrinkles in my cleavage area.
Yeah. So I just find, don't you find too, like they don't go away. So obviously it's late afternoon here, and they don't go away. You know, years ago I would wake up and they would be there and they'd be gone, you know, a couple of hours later. So I feel like the skin quality and the skin texture really changes as you get older. And relative to sun damage, I feel like it's an area of the body that gets really severely damaged very easily, wouldn't you say?
Yeah, well, the skin thins there, right?
It thins, and it's really difficult to protect and cover the décolletage, but I feel like that needs to happen starting really young, like in your 20s and 30s. And I also feel like I wish I was in the habit of wearing mineral sunscreen every day in that area, right? Because that would have made it so that you don't have that. We call this a bib in the industry, or we call it like that, you know, it looks like that, sorry, redneck t-shirt look, right? Where it's like a wife beater look, where it's really different in color. So having said all of that, it is one of my favorite areas to treat on patients, and it's a lot of fun. I call it the medium shot look. So oftentimes we take pictures of ourselves in a medium shot from here up. We want to make sure to take care of face, neck, and chest. That's so important. So the wisdom to pass on to anyone watching on a DIY tip is protect your face, neck, and chest when you're very, very young. So having said that, I love treatments like HydraFacial on the décolletage because it can be customized for the body area. And LED lights are a great option for anti-aging. So I am going to apply some of the red LED lights on the HydraFacial to her while we chat. Another super big, and technique-wise, all you SDs, you do want to have the patient keep their eyes closed if possible. And the way to get them to turn on is to grip it this way, and don't lose contact, and grip it that way. So it can be a little bit frustrating. It'll come on. There. There. So while we talk, we're going to LED light. So LED lights have become huge and really well known in the beauty industry and the medical field, because people can sit under them for up to 20 minutes and get a lot of collagen and elastin improvement. And the blue lights, like on the HydraFacial machine, help with the P. acne bacteria. So when my patients come in and they've got some breakouts, I use the high frequency tool, and then I use the blue lights. So the #1 coolest treatment I've been doing lately is Aqua Gold on the décolletage, and I think I did you a couple of months ago.
I loved it.
Isn't that great? What did you
Yes.
like about it?
I felt like the color improved, so there wasn't the discoloration. It was very smooth, and also the texture, it really smoothed out the fine lines and wrinkles. But it's something you have to do probably every quarter at least, right?
I'd say even maybe 3 or 4 of those treatments in a row. So Aqua Gold is 24 karat gold microneedling. For those at home on the DIY tip, Amazon sells the most amazing derma rollers. Just be careful of the depth. You want to order the ones that are 0.25 millimeters. And they come with the nicest little bottle of hyaluronic acid. So you can get them on Amazon. And you could do it yourself. I wouldn't do it more than 2 or 3 times a week. But they're called derma rollers. And again, it comes with the nice ones come with hyaluronic acid that you can do at home. So with the Aqua Gold, what I like to do is put Botox in the vial so that the Botox is keeping the topical or the external or the epidermis sort of stiff, like it tightens up the skin on the outside and makes the skin look really beautiful. And then you're building collagen because you're doing the microneedling, and you're getting hydration because I put HA in there as well. Right? Does it feel like that? It really, yeah. So I think if you can do 3 or 4 of those once a month, that's a good protocol. Another fun way to customize, if you have a HydraFacial machine or access to it, another great way to customize is to, you can pull the CTGF out of the vial and you can microneedle with it.
Oh wow, that's cool.
So yesterday, I got me my CTGF vial.
Wow.
Where is it now? Here it is. So this is the CTGF booster. And I went ahead and I got an 18 gauge syringe of Dr. Shafer's. And I pulled it out and then I put it in my cup so that when I did my Rejuvapen microneedling, which is a little bit deeper, I did 1.2 millimeters on her. She's an older woman in her 70s. So I not only mixed this CTGF growth factors with my Botox and my hyaluronic acid, but I also mixed squalane oil. Yay! So I love squalane oil. It can be really intense, but I mix these two together and it comes out so nice. So another great technology for on the decolletage or any fractional laser. So whether it's clear and brilliant or Fraxel, or we have sublative fractional RF on the Elos Plus, that's amazing because it's radio frequency. Ulthera is another one. We did the Ulthera.
Yep, and I really like that.
Yeah, the Ulthera is amazing. I really like that. Side note, I did Ulthera under my eyes last night, which is why I'm a little puffy, and I did a clear and brilliant session over top of that because I really like combining my treatments, so that's why I look a little puffy. So Ulthera is another great option. Radio frequency is another excellent option, and things to do at home would be the derma roller and never retinol. Did you know that? Never retinol, retin-A or tretinoin on the neck of the decolletage. You need the oil glands.
Oh.
Yeah, you need the oil glands of the face to balance out the skin stripping and thinning of the actives. But growth factors, Elastin makes an amazing neck cream that I'm trying. Yep.
Yep.
And I put that on my décolleté.
Yep.
And then skin lightening things are really great for pigmented problems like Skin Better Science, even, or Lightera 2.0 by Skinmedica, and Skinmedica's growth factors, the TNS recovery complex. So one more tip for you, in addition to some of the things that we talked about, for you at-home gals, you want to exfoliate a lot. So, you know, even if it's a whitewash cloth or not those crazy walnut beads, no, but even if it's like a little loofah, or if you've got something at home that's a eco-friendly scrub. Use that a couple of times a week because that'll really be very helpful and key in turning over those skin cells. All right, everybody, I hope you like, share, and subscribe. And hit the little bell icon if you're one of my subscribers. And I really like feedback. I love when you talk to me, so talk to me. Keep it sexy, keep it real, and keep it simple.